Good afternoon, everybody. My name is Brett McClure, and I'm just doing my presentation for the end of the year. So I chose suicide prevention in the hospital setting. And a little bit of background of kind of why I chose this particular area was that Joint Commission came and gave us a survey back in around April 1st of 2017. And they ended up citing us for we didn't have a ligature risk assessment completed in the emergency room. This was something new that Joint Commission initiated beginning to middle of March of 2017 for their big push. And honestly, we were kind of unaware of it. We had our own little assessment that we kind of had in place, but we didn't have truly what Joint Commission came on. So they cited us for it. So being one of the emergency room managers, I did a lot of little research on it and kind of found out what we needed to truly fit what Joint Commission was kind of looking at. So that's kind of how I got started with kind of suicide prevention in the hospital setting. They also started in 2017 a push for zero suicides in the hospital settings. And I'll get a little more in depth about kind of the numbers here in my presentation as we get along, but that's a big push that Joint Commission's really serious about right now. And doing some of the research, it amazed me by the numbers of suicides that happen in the ER or the hospital setting in general. And knock on wood, I've been lucky enough to say that fortunately has not happened at any of our systems that I work for, which is good. So kind of a little bit of background that, ultimately it's up to the nurses and the nursing staff to make sure that the patient is safe while they are in the care in the hospital setting. And I know most facilities have set up that they've got designated rooms for psychiatric patients, and especially the ones that are suicidal or homicidal. And a lot of them are one-on-ones, a lot of them are cameras rooms, some of them are padded, some of them are safety rooms, and to make sure that they can't harm themselves. And that was a big thing that Joint Commission wanted, was to make sure that there was no ligature risk in any of the rooms that a patient could harm them. And they would get all the way down to, anything that was about a foot to a foot and a half off the floor that could potentially be a ligature risk. So we learned a lot about what we needed to do. And some of the things that we did in our rooms, safety rooms, that we put in like plastic screws, we hid a lot of the cables, we made sure that stuff was removable, that if it was a psychiatric patient, we could kind of get the stuff out. So ultimately it is up to the nursing staff and the nursing assistants to make sure that the patient is safe, especially when it comes to rounding and different things like that. So the quality of care and the effectiveness and the timeliness that these staff members go around and check on these patients is really key to all suicidal patients. A little bit of numbers, and I don't have them memorized, so I'm going to have to look them up here though, but a study done, one of them that I looked at back in 2016, reported more than 1,100 reports of suicides in the hospital care setting between 2010 and 2014. Most of those were inpatient setting, not in the emergency room setting. So most of those, like I said, were in inpatient setting. A lot of them were psychiatric hospitals, and a lot of them were just your normal hospitals that these patients were an overdose and then they were held inside a medical room to make sure that they got clearance before they were sent over to a different facility. There was also another study that was done in 2012 that reported 1,800 cases of inpatient suicides each year. So the number is quite large, and I was shocked by the number of suicides that are not necessarily attempted, but that are actually completed in the emergency room setting, knowing that we as nurses and the hospitals have so many steps in place to prevent injury to this magnitude. So a lot of those talked about suicide preventions. They talked a lot about where a lot of them happen at, and it seems like the biggest percentage of the numbers happen is in the bathroom. Is that when a patient says, "Can I use the restroom?" and the staff thinks, "Oh, they'll be fine in the bathroom," and they let them walk into the bathroom by themselves. Most hospitals have doors that kind of go either way when it comes to patient rooms, bathrooms, but they're not physically sitting there watching them. And that's something that we put in place in our hospital just recently, that if a patient needs to use the restroom, they either use a commode or they use a urinal. Yes, it's not ideal and the privacy is not 100%, but we've got to look out what's best for the patient. So we did implement that kind of after some of this additional research on some suicide risks in the hospital. there's also a lot of strategies that we can do to kind of prevent a lot of these suicide completions that happen in the hospital setting. And and the biggest one, which we're all short-staffed, and we all know that, and we all have to watch budgeting, but the research shows that a true suicidal patient needs to be a one-on-one, and or they need to be in a camera room where an individual, that is what they're dedicated to do for their shift, is to watch all moves that these patients make. And then we need to make sure that they get the proper medications, and then they get the proper screenings in. If that means, you either screen on a laptop, on the facilities are kind of out in the kind of deserted areas of the Midwest or middle of Kansas or wherever you live, or if you've got counselors or psychiatric individuals that can come in and screen them face to face. But the biggest thing is to make sure that they are on the correct medications and they're compliant with the medications while they are in these facilities. The next thing that they truly recommended is that these patients and individuals need to be in a hospital prescribed paper gown or paper scrubs, and this kind of prevents any kind of strings or decreases the ligature risk, again, by using paper scrubs that don't hold up to a whole lot. Once again, when it goes back to patient satisfaction, nobody wants to be running around in paper scrubs. They prefer to be in their own clothing, but we do have to look out and do what's best for these individuals. So I through kind of reviewing some of the journals that I reviewed, a lot of them go back and they talk about patient satisfaction when it comes to the psychiatric patient, and we do our best, but we do kind of take away some of their dignity when we bring them into the emergency room. And and our policy is we strip them down. They are allowed to leave their underwear on, and we put them in a paper gown or paper scrubs, and they're not allowed to have any of their belongings except for a cell phone, not even the charger that they're allowed to have. So most of the journals that I read were patient satisfaction and how to increase the patient satisfaction when it comes to the psychiatric patient. And those are, I don't know if you guys are able to see at the end of the class our entire papers or not, but there's a lot of good articles about their suicide prevention and then the satisfaction when it comes to the psychiatric patient. But if anybody's interested in those that works at a psychiatric hospital, I'll be happy to send you the links that I was able to find. So in conclusion, I think that by writing this paper, I feel like I did learn a lot of additional information and truly a lot of what Joint Commission was looking at. They did come back about 35 days after their visit and redid our survey, and we passed with flying colors with the new ligature risk assessment. And then it was nice that I was able to train some of the staff members in some of these new concepts and stuff that we were able to research through this class. So it's been very beneficial. If anybody's interested in learning a little bit more about the suicide prevention, I'd be happy to share my paper with them. If you have any questions, you can always email me. Thanks. Have a good day. It's been fun working with everybody.